Let's discuss biofilms. If you're someone who's noticed your symptoms are resistant, they just don't go away, and especially if you've noticed this waxing and waning over time and you can't figure out why. I mean, sure, if you have a bad night's sleep and you don't feel well the next day, then that could account for something like brain fog or fatigue. But if you're noticing, boy, no matter what I do, I still have these random days or periods of feeling good, then feeling bad, and back and forth, a biofilm might be what's driving these either chronic non-responsive symptoms or this oscillation between feeling well and feeling unwell. This is not me being hyperbolic. Even the NIH recognizes that 80% of all chronic illness is associated with biofilm. So today, let's cover what biofilms are, 3 key warning signs you might have a biofilm present, and then overview some of the treatment options. Okay, firstly, what are biofilms? Biofilms are coatings, you could also call them a fence, so to speak, that form around a colony of microorganisms. Now, this could be bacteria, like H. pylori in the stomach, or SIBO in the small intestine, protozoa, like Babesia, kind of scary in the brain, we'll cover this more in a moment, or Giardia in the gut, archaea, which are a type of organism that underlies constipative small intestinal bacterial overgrowth, specifically this organism known as Methanobrevibacter smithii, and also yeast or fungus, including but not limited to Candida, can all form these biofilms, these fences around them. And understanding the fence and the biofilm structure helps us understand some of these key warning signs. This is what I find very compelling about this image from Cell Infection and Microbiology. What you're seeing here are the 3 phases of biofilm. First, attachment. The organism or organisms need to attach, anchor somewhere. So first is attachment. Second, the colony needs to grow. Now, part of what tells these microorganisms to grow, to start shifting their metabolism and their function into a colony, is something known as quorum sensing. It's essentially these organisms release various signaling molecules that tell them, hey, we're in a group, we can now start participating in different functions so as to live effectively or more effectively together than we would apart. Think of this akin to just random bands of hunter-gatherers as compared to people living in a city. The cities were much more resilient. Same thing happens with microorganisms, for better or worse, I suppose. So that's what you're seeing in the middle of this diagram here. After the first phase, attachment, then we have maturation. And you can see the film here around the colony. That's the biofilm. And then thirdly, there is the dispersal phase. This is where the biofilm decides to release organisms and seed to create other colonies. And this might be where a lot of the symptoms tend to flare. When the seeding occurs, this can trigger the immune system. So when we understand attachment, maturation, and dispersal, we can start to appreciate one of the warning signs, which is your symptoms require ongoing treatment and you tend to relapse. And part of that is because when you undergo a treatment, you might knock out these sort of free-floating bacteria, or what's known as the planktonic bacteria, but you don't hit the biofilm. So you have some temporary improvement perhaps, followed by regression, again, because you're only hitting this very small pocket, or not even a pocket. These are truly free-floating. You're only hitting this subset, I should say, of organisms, and you're not getting after or resolving the colony that's really seeding these organisms out there. And if biofilms are something that you find interesting, please comment. I'd be curious to hear what your experience has been. And also remember to like and subscribe to our channel. This will help you stay abreast of us, but also provides needed support to our channel so that we can reach and help more people. Okay, so let's now discuss why biofilms are so problematic or pathogenic, why they might be causing so many of your symptoms. And there's really four reasons in my view. The first, biofilms foster resistance to treatment. That fence or that coating truly shields them from whatever the agent is we're using to eradicate. For bacteria, SIBO, let's say small intestinal bacterial overgrowth, this could be something like a pharmaceutical antibiotic, xifaxan, rifaximin. It could be a natural agent like berberine. Or for fungus, Candida, you could be using garlic or oregano. Any of those agents can be thwarted in their efficacy due to these biofilms. Now, specifically, within the biofilm, there are these efflux pumps. And what these pumps do is they allow the colony to take in a small amount of whatever agent you're administering, trying to kill the colony, and then literally spit it back out. And this is why it's been documented that when a biofilm is present, it can require 10 to 1,000 times the dose of antimicrobial agents to eradicate the biofilm. So the first reason is because biofilms foster resistance to treatment. The second reason is that biofilms cause an exacerbation of tissue damage and inflammation. Quoting from a 2023 review paper, when formed, biofilms can trigger chronic inflammatory responses in the host, leading to tissue damage and impaired healing. The biofilm matrix can stimulate host immune cells to release inflammatory mediators, which can cause chronic inflammation and tissue damage. So, if that tissue damage is occurring in the brain, you could have brain fog, lability of your mood, you could have poor sleep. If it's in the GI, you might have bloating, distension, constipation, diarrhea. A theme here is chronic inflammation. The third reason why biofilms can be so problematic is because, as we covered in that dispersal phase, the colony will then seed and create new colonies over time. And when this happens, you again start this cycle of triggering worsening symptoms and inflammation. So the third reason is because one biofilm will tend to seed and form additional biofilms. This increases the load of the microbes and thus these chronic inflammatory symptoms. And the fourth reason why biofilms are challenging is because they're difficult to detect. There's not a box you can check on a LabCorp or Quest requisition form to test for biofilms. Now, there are tests available. They are in their nascency, and they are expensive. What you're seeing here in this image is a sample from a lab, T Labs. What they're finding, what they're showing here, is red blood cells are clumping together in this biofilm. So you have the healthy distribution of red blood cells where you see essentially just a smattering of dots, a peppering. But then when you get into the biofilm, you see something very different. It looks more like a gel. So rather than seeing these speckled dots, you see this gel, and this gel is the biofilm. And this is where that colony is going to reside and cause significant problems in the host with that chronic inflammation. Now, this test telling us about what's known as a platelet predominant biofilm is about $1,300. So it's not something that I think can routinely be done. And this is why I feel it's so incumbent upon clinicians to use listening skills. Now, I know that might sound a little bit counter-narrative to much of what we hear about in functional medicine, where testing and heavy testing therein seems to be what's favored. I would argue that clinicians really need to do better with listening skills because there are many areas in which the clinical diagnosis and clinical listening skills is going to be far more accurate than testing. As interesting as this test is, it's missing so many potential tissues and areas where biofilm could form. So, coming back to the clinician, this is where listening to the individual. Have they experienced symptoms that wax and wane? Have they been treated, saw some improvement, and regressed? These are all characteristic hallmarks of biofilm, which again is why I want to keep bringing us back to, and I'll get off my soapbox here in a moment, that in the area of integrative healthcare, I think we need more listening and less testing to be prudent with testing, use it precisely, because again, there is a lot. There's probably far more that we can't test, but we can, with a good clinician brain, determine based upon understanding the individual's story, history, and experience. So I mentioned a moment ago that biofilms can form in various tissues. Let's cover a few of these in brief. In the mouth, you can have plaque, as in gingivitis, or thrush, as in Candida, meaning if you have experienced a white tongue, perhaps paired with halitosis or bad breath, that can be a fungal biofilm in the mouth. There are also biofilms, many of them, that can form in the gastrointestinal tract. H. pylori, a bacteria that resides in the stomach and first section of the small intestine, can cause things like ulcers. Candida, as we mentioned a moment ago, can also occur not only in the mouth, but also in the GI tract. We can add to this list C. difficile, E. coli, Klebsiella, Salmonella, and even Giardia. In fact, looking at a 2021 study examining 117 patients, either whom had irritable bowel syndrome or inflammatory bowel disease versus healthy controls, they found that biofilms were far more common in those with IBS or with IBD and were associated with diarrhea and inflammation. Quoting the researchers here, biofilms were present in 57% of patients with IBS and 34% of patients with ulcerative colitis, compared to 6% of healthy controls. Continuing, let's look at literally what this looks like. So what you're seeing here is an endoscopic picture from the intestinal tract. Now, on the left, you're seeing healthy tissue. On the right, you're seeing healthy tissue, and it has an appearance, what's known as homogeneous. There's a lot of similarity in sort of the color and the structure of the tissue. So the picture on the right here is healthy lining of the intestinal tract, but on the left, we see this little area, again, that sort of clumpy, gel-like, heterogeneous appearance, and this is that pesky biofilm. And again, this might be why someone has done whatever the antimicrobial agent was for SIBO or Candida or whatever the GI condition was, experienced temporary improvement and then regressed because bacteria were hiding in this biofilm and using those efflux pumps to take in some of the agent that could kill them and spit it back out, not metabolizing it, therefore not being harmed by it. Going one step further, we have some really elegant research from the journal Gastroenterology that even went so far as to document where in the intestinal tract do these biofilms occur. So what you're seeing in this image is the colon. That's this larger outer tube here, colon, aka large intestine. That's why it's larger in terms of diameter, thicker. And then we have the small intestine. Now, as they travel upward with the endoscope through, this is the rectum, descending colon, transverse colon, ascending colon. You see when they get to the what's known as ileocecal juncture, that transition from large intestine to small intestine, there is a far higher dispersal rate of biofilms. These red circles indicate where biofilms were found. Now, there's one caveat I should mention here. With an endoscope, since it's literally a tube, you can only penetrate so far upward into the GI tract. Remember that the large intestine, or the colon, roughly 10 feet long, the small intestine, 22 feet. As far as it could go is this cutoff line you're seeing here. The key point to take away is that there is a very high density of biofilm formation at that juncture from large intestine to small intestine and into at least the first section of the small intestine. And in this case, since they're going backwards from the rectum upward, this is actually the last section. But all that just to say, the small intestine, and this is a concept I've been trying to champion for years, might be the most important area for digestive health, and it may also be correspondingly where the highest percentage of biofilms form. And part of this is due to nutrient availability and to pH. It's an environment that's more conducive to fostering the types of bacteria and other organisms that form biofilms. There's two important concepts here I wanted to introduce involving this bidirectional relationship from gut to brain, brain to gut. Biofilms can form in the blood vessels, as we alluded to with that platelet predominant biofilm from a moment ago. Consider this, that if there's a biofilm in the blood vessels that carry blood to the gastrointestinal tract, you could have chronic gastrointestinal symptoms, not due to an overgrowth of bacteria in the lining of the gut, but rather due to impaired blood flow to the gut. This may account for why some people say, I have all the SIBO, small intestinal bacterial overgrowth symptoms, but my doctor performed a breath test and I was negative. It could be that the issue, again, is not bacterial overgrowth per se, but rather impaired blood flow. And if there's not healthy circulation to those tissues, you can have damage, you can have impaired nutrient and oxygen uptake, and therefore those tissues become damaged and sensitive. So I wanted to tie that together because this may reconcile why some people have had lab evaluations, yet they're negative in spite of them having symptoms. And again, this is where we loop in and come back to those clinical listening skills, because as good as testing can be, it's not going to tell us everything. And there's one more component here I wanted to introduce. Again, we mentioned that one organism, and there's a few that can do this, they can form biofilms in the vasculature in the brain. So if there is dysfunctional blood circulation to the brain, remembering that the brain innervates the GI tract, you can have impaired intervention to the GI tract, therefore altered motility. And we know that this is very important because a number of studies of late are showing us that brain-based therapeutics can actually improve conditions such as irritable bowel syndrome. In fact, if I'm remembering correctly, there was recently a meta-analysis demonstrating that hypnosis can remarkably improve irritable bowel syndrome. And this is likely due to the fact that hypnosis is going to shift someone out of fight or flight, sympathetic, and into that parasympathetic rest and digest. And with that parasympathetic shift, you have a facilitation of the vagus nerve, and this through acetylcholine has a very vast anti-inflammatory and pro-motility effect. So another way of getting that same benefit could be resolving the biofilms in the brain that are impairing circulation, that are impairing the connection from the brain to the gut, the innervation via that vagal nerve. So this brings us to the nervous system. And this is where I feel we have some really fascinating, maybe a little bit scary data. There's a number of microbes, Borrelia, Bartonella, these are both infectious bacteria, Babesia, which is a protozoa, that have been demonstrated to be problematic for the brain. One study here I found to be quite insightful. It's a single individual, so it's a very small sample size, of course, but the methods from this study are fascinating. What they performed was a post-mortem biopsy of a patient with Alzheimer's. And they found that the Borrelia, bacteria, the Borrelia biofilm, and the Alzheimer's amyloid plaque all occurred in the same exact position in the brain, which suggests that part of where, sort of as I'm alluding to, neurological dysfunction can come from, not the only place, but part, could be biofilm formation from bacteria in the brain. And there's one more data point here I wanted to share. And thank you to Dr. Henry Lindner. He was on the podcast a number of months ago, sharing many data points, of which this was one. What you're seeing here is an autopsy, in this case from a canine or from a dog brain. But nevertheless, what they documented here, I think was quite pivotal. So what you're seeing in this image is a region of brain circulation that is uninfected, where the blood cells are not infected by, in this case, Babesia. And what you're seeing is the red blood cells, as you would expect, are red in nature, maybe technically pink. In the region where there is fibrin bonding, or a type of biofilm formed by Babesia, which tends to be sort of platelet predominant, if you will, what you see here, even to the untrained eye, is a shift in the color away from this sort of red pink to this faded light pink. What that is are blood cells that do not have the required amount of oxygen. Remember that oxygenated blood is this bright red, and then venous blood is a darker red. And that's because oxygen shifts the color of the blood in the red blood cells to a bright red. So if this were a human, they would have a region of the brain with good circulation, healthy red blood cells, and adequate oxygen. But in a region where Babesia is building a fibrin nest or biofilm, there's impaired circulation. Therefore, you see they are literally not getting enough oxygen to their brain. And this is where things, at least we think, like brain fog or insomnia or lability of mood come from. Again, these data are nascent, but they're nascent because it's difficult, for obvious reasons, to do real-time assessments in the brain. But nevertheless, I think for individuals who've been suffering with chronic neurological symptoms, this is something that needs to be better understood, researched, and additional treatment options need to be brought to patients. And just in brief here, there are other tissues where biofilms can form on the skin, in the sinuses, in the respiratory tract, and even in the urogenital tract. In fact, 2 studies found that roughly 70 to 80% of people either with chronic prostatitis, prostate inflammation, or with UTIs had biofilms underlying those chronic inflammatory conditions. So this brings us to the 3 clues that you could have a biofilm or biofilms present. The first, chronic relapsing symptoms. The second, temporary responsiveness to a given treatment. And then third, die-off or negative reactions from antimicrobial therapy, agents that sort of kill bacteria. But let me unpack each one of these in a little more detail. So firstly, chronic relapsing remitting symptoms, these ups and downs. Something in the clinic that's been very interesting to help people better piece together and appreciate is that the ups and downs you're experiencing may not be due to a supplement reaction or the right or wrong diet, but rather from an underlying biofilm. And you'll see this where someone will say, well, I went low carb, it worked for a little while, then it didn't help me anymore. Or I went low histamine, it was helpful, but then I don't know, my symptoms came back and I'm not sure if it's helpful any longer. Or I tried garlic capsules or berberine or ashwagandha, whatever it is, whether it's antimicrobial or immunomodulatory. And, I can't really say it was helpful. Or they think they have all these different supplement reactions because there's these ups and downs, and they're not appreciating that the ups and downs are not happening due to these changes in diet, but rather due to the biofilm going through that cycle of attachment, maturation, dispersal. And when you disperse, you have a kicking up of symptoms, inflammation, especially as you have a new attachment site. And so the ups and downs are not due to any of the changes that these people are making, but rather because of a overlooked underlying biofilm. 2, sort of alluding to this already, but temporary or non-responsiveness to treatment. Picturing in the lining of the intestinal tract that biofilm, someone may have used Xifaxan or rifaximin for SIBO, fluconazole for fungus, or Colorex, or garlic, or whatever the agent was. They improved for a little while, and then their symptoms came back. And again, that could be very much so due to treating those free-floating or planktonic organisms, which helps. But because you didn't eradicate the biofilm, as soon as that colony disperses again, you have the symptoms come back. So this temporary improvement is another hallmark. And then third, die-off. This is where when using an agent that either kills or modulates the immune system, so kills microbes or modulates the immune system, you feel worse. You have more bloating, looser bowels, abdominal pain, brain fog, joint pain, fatigue. And this is because remembering that those biofilms cause inflammation and an immune response, when you start getting into those, you kind of kick the hornet's nest, so to speak. So you have an exacerbation of inflammation and corresponding symptoms. One of the biggest gifts for us in the clinic has been helping to coach people through this. What you'll see is people who previously thought they were very supplement sensitive. Well, I can't do garlic because of the sulfur, and I can't do a given supplement due to the nightshades or the oxalates. And they've formed this paradigm that they're very sensitive. The observation, their attentiveness is good, but it's misdirected. Helping people to understand that these reactions are not true negative reactions, allergic reactions, if you will, to whatever the agents or agents are, but rather the commonality is all these agents are either modulating your immune system, helping you better fight the biofilm, or directly antimicrobial, killing the biofilm, kicking up your symptoms, which is actually a good thing. And if an individual can stick with it, on the other side of that will be a lot of improvement. So that's a very key concept. It took us many years to fully piece that together because admittedly and understandably, it can be disconcerting when you start using something and you feel like you're getting worse. And this is where just zooming out and having that bigger perspective that there's going to be some worsening before improvement can help people stay the course and get to that improvement on the other side. And just in brief, I wanted to cover some of the treatment options. Firstly, and I think most foundationally, probiotics. I don't feel any treatment plan for a biofilm would be complete without inclusion of a probiotic. And this is for a few reasons. Probiotics can compete with the organisms for that attachment phase, and they can also kill organisms when they are seeding in that dispersal phase. Probiotics, as you may already know, are also anti-SIBO, antifungal. They reduce and heal leaky gut. They are anti-inflammatory. They are immunomodulatory. And they also, and the big thanks here, I believe, is to Imam Quigley at Houston Methodist, who published some fascinating research finding that probiotic administration orally can improve the brain intervention to the gut and balance out cortisol levels. So it's not to say that the only intervention should be a probiotic, but it definitely should be one included in a biofilm therapeutic plan. Now, to complement that, there's a number of herbal compounds that are either immunomodulatory, think ashwagandha, or directly antimicrobial, think things like garlic, cinnamon, oregano. And the other interesting thing outside of the immune modulating and antimicrobial nature of many of these herbs is they also function to disrupt what's known as quorum sensing. As we discussed earlier, that's the signal these microbes send to one another saying, hey, we can shift from acting as though we were alone and start functioning in a communal fashion to mature and then disperse. So the disruption of quorum sensing, it's not unique to herbals, and many of these interventions have multiple mechanisms which they hit. I'm just providing sort of a loose heuristic for simplicity's sake, but nevertheless, this is one of, I feel, to be the more interesting and important mechanisms through which these herbal compounds can help you get over a biofilm. And I did want to cover just briefly in vitro data from Dr. Zhang, who has performed some very interesting research here, namely with that pathogenic bacteria Borrelia, which can form biofilms in the gut, in joints, in the brain. Quoting, the most active essential oil. So Zhang is a pioneer, I believe, in documenting the robust antimicrobial action that these herbals have. The most active essential oils are oregano, cinnamon, and clove. These highly active essential oils had remarkable biofilm dissolving capability. So hence why I'm including these herbals. And there are many herbals to consider. Garlic, berberine, stevia actually is an interesting one. What you will sometimes hear an individual remark, and there's been a few cases of late in the clinic that were really interesting in this regard. I can't tolerate stevia. It makes me bloated, or it causes joint pain, or something along these lines. I have an intolerance. When we understood better that stevia is actually a potent anti-biofilm agent. In fact, some doctors, Richard Horowitz would be one example, part of his very aggressive dapsone protocol for these microbes involves stevia. When we coach the individual on, let's see if it's not actually an intolerance reaction you're experiencing the stevia, push through and see if when you get to about a week or a week and a half in, that bloating, the brain fog, whatever it was, those negative symptoms, which were probably die off, let's see if they go away. And what do you know? In all of these cases, the stevia was tolerated. There was that short-term, again, a week to a week and a half, exacerbation of symptoms, followed then by an improved baseline of their function. Again, I think a big gift here in the sense that if you can understand that what used to be thought of as a negative reaction is actually a die-off reaction, it gives and provides the impetus to push through and see if when you get to about a week or a week and a half, you feel better on the other side. To be careful, I'm not saying all negative reactions are good. I would check in with a healthcare provider who treats biofilms and understands this. But it is, and we at the clinic have seen a very helpful paradigm shift to get people through reactions to the benefit on the other side. Ginger. Ginger is also anti-inflammatory and can disrupt quorum sensing. Ginkgo, anticoagulation. So those platelet predominant biofilms may benefit specifically from ginkgo. NAC or N-acetylcysteine, curcumin, and again, there are many others. Now, to complement the probiotics and the herbal antimicrobials, there are direct biofilm metabolizing enzymes. In fact, we have currently in peer review a paper looking at SIBO biofilms that we're about to publish, where we administered a multi-ingredient anti-biofilm formula, and we were able to demonstrate if we co-administered an herbal antimicrobial, let's say like oregano, along with anti-biofilm agents, this group had better lowering of their hydrogen SIBO than did individuals who were only getting the herbal antimicrobials. All groups experienced benefit, but there was better lowering of hydrogen SIBO gas when using the addition of antibiofilm agents. Now, if you've been following our work for a little while, you may be saying to yourself, well, you've been talking about this paper for a while, which is true. A few years back, the interpretation criteria for SIBO breath tests were updated. So even though it was kind of a pain, we wanted to take our paper, take our data, and reanalyze it to make sure we were in accordance with the new SIBO breath test interpretation guidelines. So we've gone through that exercise. The finding still holds. And again, this paper is currently in peer review, and I'm hoping it will be out and published within hopefully a couple months. And then finally, within these enzyme formulas that will digest the biofilm fence, lumbrokinase and nattokinase, which were included in the formula that we used, can also be used as a standalone. And I should additionally mention that EDTA, which is classically known as a heavy metal chelator or binder, can also be used because these biofilms contain proteins, polysaccharides, and also minerals. So hence where the EDTA can start stripping out some of the minerals in the biofilm. So in close, the three warning signs are chronic, relapsing symptoms, temporary or non-responsive improvements from treatments, and die-off or negative reaction from a given treatment. And to wrap this all up, I thought I would end with this quote: "Not all storms come to disrupt your life. Some come to clear your path." So if a biofilm is a storm, and certainly I would argue it can feel a bit turbulent when you have a biofilm, and especially when you go to treat it, the storm can exacerbate. But understanding that can clear these biofilms from your life, from your path, or from your system, and thus lead to what will hopefully be very clear skies or improved health on the other side. I hope this helps. Please do let me know in the comments what you think or what your experience has been. This is Dr. Ruscio, and I will talk to you next time.